Hey everybody, my name is Leila P.L. Valete, and I am the Health Education Manager here at AiArthritis, and I am here to report back on ACR 2024 Convergence, specifically some of the sessions that were about ILD or Interstitial Lung Disease. Just in general, with Interstitial Lung Disease, it is not technically under our umbrella of arthritis diseases, but it is a coexisting condition or something that may happen when disease progresses. Autoimmune ILD is specifically what it's called, and it's common in diseases like systemic sclerosis or scleroderma, rheumatoid arthritis, as well as sarcoidosis and Sjögren's disease. That doesn't mean that it doesn't happen in any of our other diseases, but those are the ones that it is seen most in. One of the studies that we had looked at ACR talked about how ILD can progress very quickly, even within just 3 months once you are symptomatic. Usually doctors only check lungs once a year, but this study suggests that more frequent testing and monitoring after the first year of diagnosis is very important. That may be twice a year, 3 times a year, and this can help see changes in the progress of the disease much earlier so that treatment can start sooner and hopefully stop the progression of ILD into fibrosis or more fibrosis, which is damaged tissue in the lungs. And that is something that you would want to prevent because it can make your symptoms a lot worse. Being able to catch it early and stop the progression beforehand can be very helpful. One thing that can be very frustrating about this, though, is that the screening for ILD, the pulmonary function tests, as well as high resolution CTs or any other screening, can be very expensive. And for insurance companies, they may not want to cover those tests, and it can end up being a very high bill for patients. So that's something that we are taking a look at and just trying to monitor, because it's very important to get the data and the information for patients so that they can have the best outcomes. But of course, we're always fighting with the insurance companies on things that should be covered rather than at the patient's expense out of pocket. The next session also talks about catching ILD early, specifically with people with RA. And they're talking about new ways to screen and diagnose patients and the way that patients can start treatment faster, which could also lead to better results. Doctors are always working on ways to tell who is more likely to get ILD. These are things like biomarkers, seeing lab tests, specific symptoms. We're always trying to see if we can pinpoint who is more likely for their disease to progress. Although there isn't any data that's readily available at this time, it's something that they are constantly looking for. If you want to see a little bit more about screening, diagnosis, and treatment, we actually have a page on our website under the coexisting conditions part of our patient journey resources, where you can see information about ILD. It's arthritis.org/ILD, and we have a patient guide available to download that has information about symptoms, diagnosis, treatment, and even a symptom tracker for you to be able to take a look at these different symptoms that you may be having over time, so that when you do talk to your rheumatologist or your doctor about progression of possible ILD, or even just wanting to get screened to get a baseline of ILD, you have data for them to go off of. I think that's the biggest thing when we're going to talk to doctors and rheumatologists, is also being able to present them with as much data as possible, because that will be able to translate into more actionable items, such as if there is lots of data that you have that your doctor is able to chart in your notes, the insurance company may be more likely to want to cover the high resolution CT to be able to see the actual imaging data on how far your ILD has progressed, because the insurance company may say they're having all of these different symptoms. If we catch it early enough now, it can possibly save them money from interventions that may need to happen in the future. When going to talk to your doctors about different symptoms and possible testing, bringing as much data, as much logs, videos, pictures that you can is always super important. If you hear crackling when you're breathing, if you get shortness of breath when, not doing exercise, or if you are having any of those other symptoms, that's something to make sure to document. Lastly, they presented on new guidelines, like ACR guidelines for treating autoimmune ILD in general. And one of the groups that helped create these guidelines is called CHEST, which is ironically named, or purposefully named, so that it has to do with ILD. These are the groups of doctors that helped create the official guidelines for autoimmune ILD. And they are evidence-based, meaning that they are based on science and research. And the goal of these guidelines are to have doctors follow the same steps so that all patients are able to get the best care possible no matter where they live. And although this is really great for these doctors to come together and come up with these guidelines, sometimes different areas of the country, different rheumatologists, different doctors start to adapt the ILD guidelines or any of the ACR guidelines at different times. And so even just being able to give yourself the knowledge of what these guidelines say can be very helpful for advocating for yourself. If you don't think your rheumatologist is going off of specific guidelines for treatment or diagnosis in any different arthritis disease or autoimmune disease, then you can bring that up to them. You can go and look up the ACR guidelines yourself and say, hey, I saw that this is the most recent research on what is recommended for the treatment of ILD, for the treatment of lupus nephritis, for the treatment of Sjögren's disease. This is what I see. Is this something that we can go off of or that we can take a look at? Whenever you come to them with the data, with the information, that will hopefully really help them take you seriously and be able to see what you're talking about and the options that you want to put on the table as well as a patient. If you want to see a little bit more about those ILD guidelines, those are also in the ILD patient guide that we are publishing and have on our website, as well as there are some social media posts that have the information about symptoms, treatment, and diagnosis. There's patient perspective videos and interviews that are on that page that you can hear firsthand from two patients that have developed ILD, what that was like for them and what recommendations they may have for those who are suspicious that they may have ILD or may already be diagnosed with ILD. Here's a few key points to think of as a closing statement from me. As a patient, you want to make sure to ask your doctor if you should get lung tests more often, especially if you have RA, systemic sclerosis, sarcoidosis, or Sjögren's disease. I had just done this with my rheumatologist last month and told him that for the past 2-3 years, every time that I get a cough or get a cold, I usually have to ask for prednisone because I'm wheezing and getting crackly sounds in my lungs. And so can we get baseline tests for pulmonary function tests as well as a high resolution CT so that we can just check in to see if there's anything developing in terms of ILD? The patient guide also has potential conversation starters for you to be able to talk to your rheumatologist of the possibility of ILD as well. The next thing that I want to say is know the signs. With ILD, the biggest things that you'll see is shortness of breath, dry cough, or getting tired easily. And that's only if symptoms have already started. If you are in the early stages of ILD, which we all hope that you are able to catch it before it gets to the point that you do have symptoms that are affecting your daily life, that is the most ideal outcome. But if you do start getting shortness of breath while walking or get a dry cough and don't know where it's coming from, thinking of the possibility that it may be a sign of ILD as soon as possible is important, and making sure to bring those up to your doctor. Do not wait. Always make sure to message your doctor, let them know if you can't get into an appointment right away, and ask them how we should take this after this. At our next appointment, can we have a discussion about this? Just giving them a heads up of what's going on in your life. The next thing is keep listening to the information about new research findings, because it can always help you make better choices about your care and be more active and present in co-creating a treatment plan with your providers, instead of just listening to everything that they have to say for face value. Of course, we value doctors so much for the expertise that they can bring to the table and the knowledge that they have about medicine and how to deal with these conditions. But what they are not an expert on is your own individual body and what you are experiencing as a patient. So collaborating on a treatment plan is super important so that it's the best outcome for both you and for the doctor to be able to give you the best treatment as possible. I said this already, make sure to be your own advocate. Early action can protect your lungs and can further your lifespan, because with ILD, once fibrosis happens and once ILD is full blown, they give you a life expectancy of 3 to 5 years. That's not necessarily always true. Some of the people that I've talked to, it has been way longer than that. But those years that they are living past the official diagnosis and treatment, it usually is happening after the preliminary stages of ILD. It is heavily affecting their everyday life. Smoke and any scents and all of those different things can cause any type of exacerbation of ILD. So keeping the air clean in their house is super important and things like that. So just making sure to take early action can be extremely important and extremely helpful for making sure that the best outcome happens in progression of ILD. And that is all I have for you. Let me know if you have any questions. You can comment below. You can send me an email at Leila@AiArthritis.org. And again, make sure to check out our webpage, AiArthritis.org/ILD, to check out all of the different resources that we have on this coexisting condition that affects a few of our different diseases. Alrighty, talk to you soon. Bye.